Is this 2 weeks in a row that we are proud of ourselves?
I would say so.
Where's our applause?
It's right here. It's right here. I have it always queued up. There's a lot of dust on it regularly, but the last 2 weeks we are rocking and ready to go.
Nice.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Allie and Kevin Ziener.
We are back for yet another great episode of Ask an Audiologist. I'm Kevin Ziener.
I'm Dr. Allie Tressiter.
For today's episode, we are going to get into the backroom dealings of audiology as we focus on, somewhat, insurance. The article was written by frequent contributor Dr. Deanne Rudden of Longmont Hearing and Tinnitus Center and Dr. Allie, and I promise, with a capital P, to make this as fun and interesting as humanly possible.
The key word there is try.
I try. There is no do, there is no try, only do, says Yoda. We are infinitely in the try.
Yes.
So here's the caveat. There's a hard answer that we're going to circumvent for the foreseeable future and then eventually present it. Because then this podcast would be 60 seconds long.
Yes.
Okay? Dr. Allie, with a broad brush,
Okay.
with the caveat that everybody is different, their policies are different, what their policies do or do not cover are different, and
Correct.
the only way for them to truly understand it is to talk to their provider.
Correct. And
Yeah,
their insurance.
and their insurance company.
Correct.
What is a blanket approach to audiology and insurance? Be as vague as possible.
Well, in speaking, and this is for the U.S. specifically,
Yes.
right? Because obviously there are different healthcare systems, but insurance in the audiology world is confusing.
Yes.
I mean, that is really
Amen,
the best
sister.
way to put it because, you know, a lot of times insurances will say, hey, we have coverage, but really it's not coverage. It's a discount program. And sometimes these programs limit who you can go see as a provider. And so it's all very confusing.
Yes.
That said, a lot of insurances and Medicare will cover a hearing evaluation.
Got it.
Yep. So if you just want to go and get your hearing tested, and if the thing that's prompting your hearing test is tinnitus,
Yeah.
that will be covered by Medicare.
Love it.
Yeah. Was that vague enough?
I think that was extremely vague enough, and I love that. And then the only other piece that I know, again, because I don't work in insurance, I certainly don't work in billing or anything like that, is that depending on your insurance provider, some, and depending on how good your insurance is, to all may be covered as it relates to your hearing aid.
Yes. So again, that it's really a huge tangled mess
Totally.
to figure out what is covered. And that's why it's really important to talk to your insurance company and your provider and to make sure that provider is covered by that insurance or third-party program.
Yeah.
But I totally forgot your question.
Oh, I don't think there was as much of a question as depending on your insurance,
Yeah.
a small percentage to the totality could be covered in the cost of
Right.
your hearing aid.
Right. Sorry. Once I start thinking about audiology and insurance,
Yes.
it breaks a little part of my soul.
I'm with you.
But yes, so as far as hearing aids are concerned, it really is a lot of times it ends up being some sort of discount program and not a true insurance benefit.
So we've dodged this answer for 3.5 minutes now. Dr. Allie, does Medicare pay for tinnitus treatments? Give us the longest answer you can possibly think of for a very, very, very easy answer.
So I was born in
Love it.
1989
Take us
in
back.
Milwaukee, Wisconsin.
Were they covering tinnitus back then?
They may have.
Okay.
Listen, 1989 was a crazy year.
Wild times.
It was wild. Man, I don't know how to make this much longer.
I think
other
you've
than
done a
just
good
saying-
job. It's about 25 seconds.
Okay, cool.
Yeah.
So long story short, no.
Got it.
Insurance does not.
Thank you guys so much. Have a great rest of your Monday.
Bye. Medicaid specifically will not cover tinnitus treatment on its own, which is why the caveat of they will cover a hearing test.
Sure.
And I believe the benefit is once a year. And your tinnitus can be what is prompting you to get a hearing test, because like we've talked about before, often tinnitus and hearing loss go hand in hand. And so at least identifying and diagnosing a hearing loss and or tinnitus is the first step.
Okay.
And during that appointment, you can get some guidance on the best way to seek treatment, right? So at least getting that information is really important.
So you are able to get the diagnosis, and that is great. That hopefully does not come out of pocket for you. The short and long-term treatments are on the patient. Right. Or unless you have some real good blackmail on the audiologist.
Yes, that. So if you don't have blackmail and you're one of just us regulars,
yes.
A lot of times you have to pay out of pocket. But that's why it's important, though, to talk to your audiologist about the different treatment options because, a lot of times, like we said before, patients who have tinnitus usually also have anxiety or depression or some of these other things going on. Yeah. And so seeking things like cognitive behavioral therapy, which could be covered by your insurance, could be an avenue for you. Yeah. But just going and getting that hearing test, remember, we've talked about things like caffeine can make tinnitus worse, alcohol, nicotine, stress, lack of sleep, all of these things. So blood thinners, unpacking that is really important because your tinnitus could be caused just by something in your lifestyle. Sure. I think even though some of those more specific tinnitus treatments aren't covered by insurance or Medicare, you can still get a whole buttload of information just by going to that initial hearing test.
I was going to say, obviously depending on the severity of the tinnitus, short term turns into long term. And depending on the tinnitus not being much, short term is the only answer. Like, I think you can live with it, right? Mm-hmm. So have at it. What are common treatments? I mean, like the most common treatments that you see for tinnitus that maybe are like a one-time fee or things that the patient themselves can do that aren't billable.
Sure. Again, apart from some sort of lifestyle change, like, changing blood thinners or some of those medication or diet related issues, things like honestly going on Amazon and buying a $20 noise generator or even downloading an app on your phone and having that background noise. Because a lot of times people will say their tinnitus is the worst when they lay down at night and it's silent in the room. Okay. Because if you're out and about and there's background noise, the tinnitus isn't as prominent, right? Okay.
And what do they call that? I got it. I'm not even looking at the article right now. Masking.
Yes.
Right? The ambient noise, the white noise masks the tinnitus that's happening.
It sure does.
Yes.
That's exactly what happens.
I have hung out with you long enough to get some things right.
I'm so proud.
Emphasis on some things.
I'm very proud of you.
Thank you very much.
Yes.
White noise machines.
Yes.
Good for sleeping at night.
But I mean, really, it's hard to answer that question without knowing the origin of someone's tinnitus, right? Because there are so many different causes. Yeah. But like we had talked about a couple of weeks ago now about the new tinnitus treatment that was just FDA approved that actually is looking like it could be a legitimate cure. Cool. That it's yet to be seen if that will be covered by insurances or if it's going to have an out-of-pocket cost. But I think the tinnitus landscape is ever evolving. Okay. And so it's important really just to kind of keep on top of it, keep reaching out to your insurance companies and ask what's covered.
I have this list here that I'm going to read, and one of them is going to it blew my mind when I read it. It's going to blow everybody else's mind. Okay. So the lifestyle changes, right? The things that you can control that really don't ultimately cost you anything besides time. Reduce exposure to loud sounds, obviously. Makes sense. Decrease your salt intake. Harkening back to last week's episode or 2 weeks ago, be healthy with the food that you consume. Yep. Monitor your blood pressure. Avoid an intake of stimulants like caffeine or nicotine. Exercise often. Love that. Try meditating, going on walks, calming yourself, reducing that anxiousness, that stress. Reduce the amount of alcohol you drink, which sad but true.
Yes.
Here's the one that I love. Avoid total silence.
Nice.
Yeah. Silence can cause tinnitus.
It's not okay.
Or are you just more aware of it?
You're more aware
Got
of
it. Okay.
Yeah.
Fair. It would have been funnier if it's like the thing that your ears need, silence, you don't want it.
Yeah, no. It just makes it, if you have tinnitus, it makes it worse.
Fair enough. I was hoping that some monk was like, I've never heard a sound ever in my entire life, and I have this horrible ringing in my head. I cannot get rid of it. I'm proud of us. We took a topic that could have absolutely railroaded this episode, though we get paid by the minute. So that's why we had to extend this.
Yes, for sure.
We couldn't take the loss of 30 seconds.
No.
But I think we did a yeoman's job of explaining what insurance may cover as it relates to tinnitus and hearing aids, what it won't cover, and then all the things that you can do should you yourself want to be in control of hearing it.
Is this 2 weeks in a row that we are proud of ourselves?
I would say so.
Where's our applause?
It's right here. It's right here. I have it always queued up. There's a lot of dust on it regularly, but the last 2 weeks we are rocking and ready to go.
Nice.
So if you have any questions about insurance, ask your doctor and definitely ask your insurance provider.
Yes.
Do not ask us. This is
No.
Ask an Audiologist ... not about insurance.
Yes. Listen, I can treat patients all day,
Yes.
but when it comes time to the billing piece, I just hand that
Yep.
over to the person that's really skilled in billing.
Yeah. So if you're looking for answers, look anywhere else but from Dr. Allie and I. That is your safest bet. But if you have any audiology questions, then please visit askanaudiologist.com. Dr. Allie, always a pleasure. Thank you.
Kev, thank you.
See you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
You should be fearful. I'm gonna play a
I was going to play a sound.
I knew it. I knew it.
You should be scared.
I could tell by your face.